This morning I have my baby appointment and the glucose test. Today I think we're gonna talk about the ultrasound, the follow-up ultrasound where the spot was still on baby's chest. But I'm not doing any more ultrasounds, so I just decided that on my own. We'll see how it goes. Oh, I have to fill out my admission packet. Almost done. This depression scale. I'm here waiting on the doctor, filling out this paperwork for breastfeeding plan, and then I have this other paperwork for the Tdap shot. I didn't know I was getting any type of shots today, so I'm surprised. I'm gonna ask the doctor about it because I didn't expect a shot. I expect to come here, do my appointment, and do the glucose test, and that's it. So I'm gonna ask him about that. I just had my 28-week pregnancy appointment, and I think this was worse than the first one. When I had my first appointment, I think this was worse than the first one. So at this 28-week visit, we're supposed to discuss preterm labor, fetal movement, gestational diabetes, get screened for depression, answer the questions I have or concerns. So first of all, this appointment, I have a different midwife. I've been seeing the same midwife this whole pregnancy until today. I got a guy. I don't care female or male. I normally see a female, but I got this guy today, which is fine. I don't mind male, female, as long as you know your job. So I go to see him, and he asked me if I had any questions or concerns. So I told him, my leg gets numb. It's numb now. Just from walking from the waiting room to his room, it's already numb. And sometimes I feel like I'm going to fall. So he said, it's normal pregnancy. It's your sciatic nerves. The only relief is once you deliver. I understood that. And he said, have I ever fallen? And I said, no, I haven't fallen yet, because once it starts getting really bad, I just sit down and rest it or lay down. So that was fine. And then I asked him about my PHA, because I need a PHA done. And I was asking him about at this clinic, because this is the only clinic I've been seen at other than on the ship. The last time I was seen was on the ship, and of course Balboa, but Balboa is not my clinic. So I asked him about it, and he starts cutting me off. So I'm like, wait, hold on. I snapped at him, like, why are you cutting me off? He's like, well, I don't know anything about that. Well, I'm telling you, I'm getting the runaround, and somebody's gonna fix it and figure it out. And there's no reason for you to snap at me, because I'm not a medical provider. So maybe you need to go find somebody that can help me, since you can't. And he started getting like, oh, I'm so sorry, that's not how I meant it, blah blah. So he started being super helpful after that. But he kind of like snapped at me like he didn't know. Who else? I mean, can you find out? I mean, can you do something? I've been seeing you guys since I've been pregnant, other than, the ship. So somebody did something wrong and put me at the wrong clinic, and somebody needs to figure it out, because I've been calling around and I'm not getting any answers. So we didn't discuss any fetal movement. We didn't discuss anything we were supposed to. He measured my belly, listened to the baby's heartbeat. That's about it. Gestational diabetes test that was supposed to be in, I go to the lab, it wasn't even there. He put in blood tests for the Tdap shot, and that was the only thing in there when I went to the lab. And I was like, you know what, it's fine. I'm not even gonna go back up there to him, because obviously he doesn't know what he's doing, and eventually they'll test me for gestational diabetes. I don't care whether I get tested or not. I really don't. I know I don't have it, so it doesn't even matter. Then I go to the pharmacy, and he's supposed to order some stuff, which he did. So he did that right. And let me see, what else did he do right? I would say that's the only thing he did right at my appointment today. Oh, one more thing he did do right. Sorry. So we talked about the baby's heart. Well, not the baby's heart, but right by the baby's heart there's this white spot. He said he can't tell what it is. He's looked at it. He's not gonna make me do another ultrasound, which is perfect because I was gonna tell him I don't want another ultrasound anyway. I've had enough ultrasounds this pregnancy. I don't need any more for you to tell me there's a spot by her chest, because obviously we can't do anything about it. If it's there, it's there. She's gonna come either way. But he did give me a referral to what's the name of this clinic? The fetal assessment unit. So the fetal assessment unit, the doctor is supposed to call me and schedule and set up something. Another thing they didn't do is I delivered my last baby in Virginia when I was stationed there, and they were supposed to get the records. They did this from back when I was 12 weeks. My first appointment, they had me fill out the paperwork to get it done. Never got done. I called back a few weeks ago about getting the records because the doctor at Balboa needed it for him to see what happened, why I had to get a C-section in the beginning. They just need to get all that medical stuff, and they still didn't do it. So today they're supposed to be faxing it again to get it from Portsmouth. So we'll see how that goes. One more thing, I'm about to go to this Marine Corps base. That's where my primary care doctor is, and they can get me switched to whatever clinic it is. I don't know who put me at some Marine Corps base. I guess it's where the Marine Corps boot camp is. He said it's 7 minutes down the road from here, so I'm just gonna drive down there and see if I could get switched to somewhere closer to my base. We'll see how this goes. It's always getting to run around with TRICARE, Navy Medical, so I don't know what's gonna happen. I don't know what. I left. Oh. So I went to that Marine Corps, whatever, medical place, and they were like, "Oh no, we don't do that here." Of course you don't. This is such hard work trying to change my PCM, and I don't even know who assigned me to that PCM in the first place, because it's not the closest one to my duty station, and it's not like they didn't have providers that I could get. So I get on the phone with TRICARE again and tell them the runaround they gave me, and this lady was so nice and changed it and did everything she was supposed to do and apologized for them. So thank God for her. Here eating lunch, Chick-fil-A, then gonna go to work for these last few hours. I'm hungry, so I wasn't gonna drive and bring it to work. I barely ate breakfast. I just ate some fruits, so I'm eating this, then I'm gonna go to work.